I'm part of Ithemba, a social enterprise focused on rethinking breast cancer diagnosis. 2 years ago, I traveled to rural clinics in South Africa and saw firsthand how cancer is seen as a death sentence. If a South African woman suspects she has breast cancer, diagnosis is often not available at her local clinic due to lack of training and proper medical equipment. Many patients travel hundreds of miles and to multiple hospitals before receiving a diagnosis. This results in significantly skewed fatality rates due to high proportion of late-stage cancers.
The critical step in obtaining a diagnosis is the core needle biopsy procedure. The current reusable core needle biopsy devices used in developing countries are susceptible to internal contamination that demands a complex cleaning procedure, while disposable devices avoid contamination. They're expensive and limit the number of devices a hospital can purchase. Local clinics do not have the resources for biopsy devices. While it takes the woman in the US only 2 weeks to get a diagnosis, it takes up to 5 times that amount in countries like South Africa.
Our team is motivated by the belief that every woman deserves access to treatment, so we have created a novel core needle biopsy device that is reusable but avoids contamination. Our device contains a novel chamber that collects contaminants and separates the needle attachment from the complicated spring mechanism. This design prevents contamination and greatly simplifies the device cleaning process.
This is the currently used barred magnum reusable device. Blood travels through the coaxial needles and gets inside the mechanisms of this device. As you can see, there's very complicated spring mechanisms, which causes the cleaning procedure to be multiple hours, and in limited resource hospitals, this can take up to 24 hours. Our device has a novel contamination trapping component that's located in between the needles, so that when the device is fired, all blood and tissue contaminants go inside this bellow and it is trapped, and then this is disposed of each procedure. Our device uses Lego-like connections to connect the disposable needle with the reusable needle. So this just clicks in. Once the disposable needle has been locked inside the device, the lid goes over and a cover is on. You then fire the device and collect the biopsy sample here.
Within the next few months, we'll be working on testing and marketing our device in South Africa with radiologists and hospitals that we've partnered with. First, we'll sell the device to hospitals in South Africa with existing biopsy capabilities, allowing them to diagnose more patients using their existing budgets. However, our ultimate vision is expanding biopsy access to all levels of healthcare to enable effective treatment earlier in their cancer's progression. Now, when patients hear the words breast cancer, we don't want them to think about a death sentence. We want them to think about how they can fight this disease.